Okay, December 31st. As you can see, I'm not done yet. There's the jars all jarred up, some for freezer, some to start using for microgreens. This box is going downstairs. This box, remember when I said to Pastor Granny, you know, Pastor Granny, she said, why you do this? Why you do this? And I'm like, well, because we just don't know what's going to happen. Yeah, but I'm here. Don't worry, don't worry. God will take care of everything. I said, yeah, but at the end of the day, I can't depend on you to be there all the time. And then look what happened, people. Not even a month later, she died. Okay. So now this did come from Pastor Granny in a roundabout way in regards to her daughter came by and let me grab a few things, and potatoes was one of them, as you can see. I was going to can them, but I don't have jars right now, and that's okay, because if I dehydrate them, it takes up less jars and it's less weight. So I've decided that today is the day. I'm going to wash them all, peel them all, shred them all, and then blanch them for 1 minute, and then drain them, run them through cold water, and then put them on a dehydrator and dehydrate them. And I don't know how many jars I'll get, but we'll see. Okay, so as I'm working on the potatoes, right? This is an update, right? Okay? Right? We'll talk more about it later, but I just, really, people, I just want you to hear this, okay?
An additional 2,353 surge beds for 11,582 total beds. In critical care, our census was about 420 yesterday on 510 base beds and 218 surge beds. And we will continue as we can, as we do in this period normally, and as we attempt to reduce our existing population so that we have space and are ready for others. These are the steps we did. This is how we exercise control. Our acute care system has been resilient, and what healthcare...
You know, canceling surgery, that's what it is, people.
Workers have done throughout this pandemic has been heroic. But our biggest test, this may be as big a test as we have faced through this pandemic. And so we are taking those steps, and we need everyone to take those steps to exercise the control we have. And with cases, numbers rising like this, there's a sense of lack of control, but we have control. Control means this evening, limited gatherings. Celebrate with the ones you love. Control means limited gatherings in general. Control means staying home when you're sick. Control means wearing your mask. Control means washing your hands. Control means when invited to be vaccinated to book an appointment. And
I guess they invited 240,000 people to get their booster shots, and people haven't responded yet.
To get vaccinated. And British Columbians, from the beginning...
It'd have to go back and verify that number, but it's in the hundreds of thousands anyway.
With this pandemic, on all of these measures, have been exercising that, and together we have been facing significant challenges throughout the last 22 months, and we will face those challenges as we go into 2022. As Dr. Bauman said, 905,700 people have received their booster doses. This is about 175,000 more than we had planned for, which reflects the work of people in our system and the extraordinary work of Dr. Bauman and her team. And that number will grow and grow significantly as we move into the next phase of the booster campaign. As Dr.
They're trying to build them in every 6 months, people. Every 6 months they're putting you on a schedule.
Alan has explained, now that...
Like I said, that national junkie, well, I don't know how else. Look at Sierra, that's all you have to do, people. That's all you have to do.
British Columbians at heightened COVID risk have all had their booster invitations. We will move forward with invitations to people based on when people got their second doses. When you get your invitation, book your appointment and get your booster.
When you get your invitation, well, maybe you don't want to go to the party, right?
As Dr. Bauman said, 240,000 people have received invitations and not booked their appointment.
240,000 have received their invitation but have not booked their appointments.
As of this point, and I say to them, as we expand the number of invitations we send out, this would be a good day. This would be a good day when you're one of those those people in those vulnerable categories, and if you're one of those 240,000 people, you're there because you have vulnerability to COVID-19. This would be a good day.
He can't speak for 5 million people in the province of British Columbia, Canada. No crystal ball can be that accurate.
Final day of 2021 to book your booster dose, and I encourage everyone to do so. One of the reasons we have one of the strongest vaccination programs in the world is the work of volunteers, retired healthcare.
That's what I kind of wanted you to hear, people, because, you know, working on the nonprofit all these years, for 21 years, okay, seriously, that was the number one rule I learned early on. If you aren't trying to do something for the government, they're not going to touch you with a 10-foot pole because they have their own system, right? They won't partner up with you as a volunteer group per se, right? They're at arm's length to those where they're supposed to be at arm's length. Just like in schools, they're not allowed to advertise other people's products in the schools, so that, you know, if the so-and-so makes a donation to the school, it doesn't give them the right to start advertising their products all over the place. That's a conflict of interest. Now they're recruiting all these volunteers, people, because at the end of the day, when people start coming back with lawsuits, they're not going to be able to point a finger at anybody, because where the injury occurred were in either coliseums, pharmacies that may or may not still be in existence. In other words, you go back a year and a half later, sicker than a dog because so-and-so poked you with something, right, that had nothing written in the inserts, and the doors are closed, and the shop is folded, and it's no longer there. Or the employee is gone. You don't know who it was, right? You don't know what volunteer did what to you, because, you know, it's just offloading people. That's what it is, right? Other people are already talking about it on the internet, okay?
Workers, medical students, first responders.
Who wants a medical student? Let me tell you something about a medical student. All right? First of all, when Amari went in for his first MRI, right? Brain scan, to determine what was wrong with him, even though everybody fucking knew. Anyway, they botched it, right? They botched it. But of course, they had to do the blood series, rule out chromosome defect, you know, birth defects, that kind of stuff. I have a video on this, people. They had some Chinese guy come in and was poking Amari. Okay, it was here. Poking Amari 25 fucking times trying to get the vein. Then, right, went on to the next arm. Started doing the same shit. Then wanted to go back. I said, hold on. This is enough. Enough is enough is enough. You need to fucking stop, okay? Like, seriously. You need to do it right here. Oh, no, no. Doctor says I have to get it. I have to get the blood. I have to get the blood. It was like he was in fear of the doctor. And I'm like, yeah, okay, no problem. But you're not going to get it that way. Anyway, I ended up getting somebody else to come in. I said, go away and have somebody else come and try it. Because it was obvious this guy couldn't do it. And he was under too much stress. He had to perform for the doctor. And all he was doing was hurting Amari. Time after time after time. Even Tisha was getting upset about it. And they're so fucking sneaky, I'm telling you people. Anyway, they ended up doing it that way, I think. It was okay after that. But like, they poked him like 25 times. At least between the two fucking arms. Up in here trying to get blood. And that was a student, okay? Whatever they had doting after Shimei outside of the senior staff that are the Lucys that roam the halls with the Draculas in there and the Dr. Ghouls, okay, they had some pretty dumb fucking students, okay? I'm sure it was a student who did the embalming because they botched that too, people. Okay, it was leaking down the neck. Well, it was on this side of the neck. It was all leaking down from the jugular vein. They tried to put a big fucking Band-Aid on it, like talking a big Band-Aid, but it wasn't enough. It was still fucking leaking. Poke marks all over her arms, up and down, up and down. It was leaking. Looks like she had fucking chicken pox or something, right? I couldn't see her legs because they had put ice packs on her legs, but she clearly was fucking bloated and she was clearly embalmed, people. Okay? And they had their fucking students, whatever. Either they embalmed her or they fucking were practicing with their makeup, with their embalming makeup, or they're fucking morbid. Okay? The healthcare system has gone off on the deep end, people. Seriously, it is so fucking morbid. And now that they're trying to push to bring in transhumanism, they took out Shimei's teeth, people. They stretched out her skin for a reason. Okay? Whatever they were doing was under the fucking skin. Okay? It wasn't over top of it. The makeup was over top, but the fucking little patches that were coming in through the exposure was their electronics to do something to the skin to make it appear like it was alive. To which I'm pretty sure after it's all said and done, people, they take it after the fact when nobody's looking, slither it off like an animal, hang it up to fucking dry, and then put it on their freaking androids. Because silicone doesn't work. Rubber doesn't work. Look it up. Look it up. They'll tell you it's not what they want. It doesn't conform the way they want it to make it look like it's real.
And others have stepped up to make sure British Columbians get their booster and the additional layer of protection as they have been stepping up since our vaccination campaign began more than a year ago now. I want to thank every British Columbian who has volunteered for the booster effort, and I want to encourage others who are able to join the effort. Every volunteer means...
Yeah, they're just recruiting a whole bunch of fucking Tom, Dicks, and Harrys. That's it. To give shots. In random places, people. In coliseums, in fucking clinics, school, gyms, in pharmacies, outside of fucking homeless shelters, wherever.
More British Columbians getting boosters.
All done by volunteers.
Faster.
Well, the majority of it.
If you can help, register today with your local health authority.
Isn't that a conflict of interest, or is that passing the buck when the shit hits the fan and somebody wants to file a lawsuit? Who are they going to go after? The government? What do you think the government's going to say? Who was a volunteer? We don't know who it was.
Or email BC Vaccine Management Program, all one word. The program is PROGRAM, and this will be part of our bulletin today. BC Vaccine Management Program at gov.bc.ca.
I don't know why they got such a hard-on for this shit, people.
We've seen tremendous sacrifice by people following public health orders. I just want to note the decision made today to limit visitation to...
This is what I wanted you to hear.
Long-term care, a hard decision for...
So they limited visitation to the old people again. Why? So they can start mysteriously dying? So they can come back in fucking 3 weeks from now reporting all this mass death with the old people all of a sudden out of the fucking blue? Right? And being that YouTube with their webmasters probably corrected their cache system where these fake pre-recorded live streams, okay, are coming in at the jump of the queue at the beginning of the card deck so that you can't catch them in their fucking lies, right? It's just gonna, what, spread more mass hysteria?
For all of us, for those of us, such as myself and many others who have family members in long-term care, these are difficult and challenging steps.
Do you honestly think this guy's got any family members sitting up in long-term care? Yeah, okay. And if he is, why isn't he he's got so much fucking money. Why is the family member not at home with him? What's the matter with him? Why can't he have private care come in and look after his mother or his father or whoever it is that he's got locked away like a dirty fucking secret?
But necessary to protect residents in this moment. And
protecting residents, even though they've been shot up twice, getting their boosters. Oh yeah, okay.
We all know the challenges that healthcare workers will face in long-term care and are due to the challenges of the Omicron variant concern in it.
And they're having a shortage with healthcare workers in the old folks' homes, so they're allowing some people who are kind of sick to go back to work.
And it's moved through populations, and healthcare workers are not excluded from that. I also want to finally report on surgery.
As a matter of fact, people are fucking quitting. I know someone that fucking basically quit because of the bullshit with a lot of the workers not even doing their fucking jobs, right? I'm serious, people, okay? They don't do their jobs, right? They don't like, and especially if you're white, they don't like old white people. They see us as institutional racists who don't belong on this planet. Right? Bring in more fucking racist immigrants and then say you're doing justice to society. See, just with this kind of shit, I have to put it on BitChute. I can't put this up on YouTube. I can't risk it.
In the week November 28th of December.
Because YouTube can't handle the fucking truth. Right? I've seen it with Uncle John, a whole bunch of fucking old white people, old ladies, old men, all locked up like dirty secrets. We're literally forced to sell their houses, people. We're not allowed to leave, right? Fucking cops prevented them from fucking leaving, okay? They were forced to pay for their temporary care at the temporary care facility. And then after they were forced to pay for that, after they sold their fucking house, they were forced to give up I think over 70% of their fucking income after the fact to pay for their long-term care. And then they were locked up like a dirty secret right along with Uncle John and thrown away and forgotten about.
Number 4th, our most recent reporting period.
And who was looking after them? For the most part, outside of senior staff, the Lucys. A bunch of fucking immigrants that came from God knows where, every country under the sun, couldn't speak English, didn't want to learn fucking English, had a bad fucking attitude, didn't care if they sat in a dirty diaper, okay? Lied to Uncle John, here's your calcium bill, but we're not going to tell you that we're giving you a fucking opiate and doping you up. So we can plot a scheme with the senior staff how to steal your money.
6,951 surgeries were completed in British Columbia, which is essentially the same number as was completed in 2019.
I'm cooking.
That same week in 2019, an extraordinary
My burner is burning and I got steam going.
achievement when you consider all that was going on in our healthcare system, including...
I'm preparing for the BC Apocalypse. You know what I'm saying. Apocalyptics. Oh my God.
Because of the Delta variant, the move of many patients
Doomsday!
from the north to other parts of British Columbia. And while urgent and non-urgent surgeries are continuing throughout the province from December 19th to 25th, health authorities postponed in that period 110 non-urgent scheduled surgeries, 3 in Fraser Health, 66 Coastal Health, 41 in Interior Health. Cumulatively, from September 5th to December 25th, there have been 3,991 surgical postponements due to regional surgery.
Since September, okay? That's what? September, October, November, December, 3.5 months.
Of COVID, and factors include...
That's 1,000 surgeries a month. But yet they want to cut into Amari under a fucking research study. Okay.
Including severe weather patterns.
To prevent pain that he doesn't even have yet. Knowing that they could create lifelong pain. And opportunity to go back in and do it again and again and again. And then when he dies, they'll say, oops, sorry, you knew the risks.
Last week, we announced several measures to help slow the spread of Omicron in our communities and keep people safe. At this point in our pandemic, after all we've covered in charting our progress and fulfilling our surgical renewal commitment, I think more than ever we understand how patients in need of surgery are anxious about it. You bet they're anxious about it. Every one of those surgeries I referred to is medically necessary, and it is difficult for everyone who's doing this work, who completed the 6,900 surgeries in the most recent reporting week. All the people, the staff, the families, everyone involved knows the importance of this, and it is especially challenging in our time of pandemic. There is much going on as we all put our best efforts in slowing Omicron's spread.
Doesn't that, now I'm just going to end it there, people, okay? I wanted you to hear one other thing where he was talking about all these people going around, you know, giving these inoculations or whatever it is, you know, they're not machines. Well, I beg to fucking differ. I beg to fucking differ, people, okay? Whatever was doting after Chimay, okay, was not fucking normal, okay? There was nothing normal about what they did with Chimay. From the time they came in through the door and put on their little fucking freak show, okay? And then hauled her off in a hammock, 3 men on each side, to the time they fucking threw everybody out, and within 3 hours, that was it. She looked like a beached whale that had been attacked by stingrays all over the place. Okay? And then her body just proceeded to decompose after the fact, and they tried to slow it down as best as they could, people, with their technology. And then after that, you think they just tossed it out in the fucking furnace? I don't think so. Hell no. No, somebody put on her fucking skin. That's what happened. Okay? That warrants being on BitChute, because YouTube can't handle the fucking truth. There you go, YouTube bitch. And one final note. This individual reminds me of Joan Duncan, John's wife, okay? Who was an anorexic, seriously, for her whole life. And not only was she that, people, but she was bulimic her whole life, okay? And then she was addicted to opiates and other psychosis pills, psychotic, and just, she was suicidal and just had all these mental health issues compounded with 15 different fucking medications that the doctor had her on top of opiates, like oxycodone and OxyContin, okay? And then she tried to get John to take them, all right? This woman, I'm serious, this individual looks like Joan Duncan. It's either that or she's an alcoholic.
Dr. Henry says we're shooting for a 2 to 3 week average over the beginning of January, and that will get better, and we'll bring capacity on, literally day by day. So we're extremely grateful and enthusiastic about the response we've had from immunizers. We need to schedule them
from volunteers, people, from volunteers.
In now across the province and do our very best to, continue to expedite our booster campaign.
Okay, yeah, with volunteers from God knows where.
I was going to say that, I think that part of the issue of the booster campaign is that we announced our plan and laid it out in detail. On October the 26th, Dr. Baum, Dr. Henry did that at that time.
Ooh, the doctor of anorexia and bulimia and psychosis.
Then we've increased and we're over what we had planned for.
If I was to show you a picture of Joan Duncan, you would see exactly what I had to say about that one in regards to they almost look alike, okay? And that's for a reason, people. It's either that or alcoholism.
175,000 administered doses, 175,000 more than we planned to. Concurrently, and after that, children 5 to 11 became eligible for the pediatric vaccine, a very significant number, 38% have already been vaccinated, 48% have registered. We encourage everyone to get registered. So we are dramatically ahead of the schedule that we put together on October 26th. And week unto week, 514 pharmacy locations now available, 254 to be added this week, another 200 by the middle of January. And I can tell you as well that for those people who have received their invitations, including the 240,000 who've received and not booked,
including the 240,000 who received but not booked.
there are,
as they're closing down access to the old folks again, people, again, and they're all maxed out with their jab, right? Nobody's missing a shot in those places. They're on fucking lockdown.
All health authorities, not in all communities, but in all health authorities, vaccine.
With a bunch of workers that don't want to do their jobs, to the point where the ones that actually liked working with the old people fucking quit. It quit for a reason, people. Because the old people are wallowing in misery, not being looked after properly. And they don't want the public to come in and see it.
Vaccine appointments available on January the 2nd. Even in Vancouver Coastal Health, where there's a relatively higher uptake in vaccination.
I don't know what it's going to take, but you see, the problem with that, though, is there's too many people out there waiting for their loved one to die, because as soon as they die, they think they're going to get their grubby little fucking fingers in that superannuation life insurance policy. Doing Eleanor Gilding. The program manager of the provincial government immunization fucking program that they're running today. I noticed that they don't ever call out her fucking name. I wonder why, people. Google the name and see what fucking comes up, and look at the board directing that she's been sitting on. She runs the immunization program for the fucking province. That's the one that medically kidnapped Uncle John for the superannuation life insurance policy and anything else that he inherited, the stuff that Joan Duncan left him through her superannuation life insurance policy and any other fucking life insurance policies that she had, because she was always dying every 2-3 fucking weeks for 25 fucking years straight, for as long as I knew her, people. Do you honestly think half of those people with their loved ones sitting up in these old folks' homes give a shit how their dad, their mom, their brother, aka Uncle John, are being treated? No! I'm here to remind you of that. No! Because they're just waiting for the money to cash in. And that's assuming that the government doesn't steal it through the, what is it called? Adult Guardian Patient Act, through the public trustee organization that's supposed to be at arm's length with the government, but it isn't. So that they can scoop up on that money and put it in fucking lockdown and have the lawyers just bleed it dry. As the family is left high and fucking dry. But for a large amount of those families, they don't care. So I can't see Dad. It's one less trip, right? Well, Dad dies. Well, that's Dad. He was getting old. I got money now. I got his government pension, assuming that the government didn't fucking steal the pension. Okay? Seriously. This shit makes me just so livid, you don't know. You don't know, people. I've been living it a long fucking time. It's like, I don't know how people could be so gullible. So fucking gullible. But it goes back to this. It goes back to Shemaine going into grade 10, right? From homeschooling and being an honor student just because it was already in her. You see, the school, they tried to squish it on her. They tried to fucking turn her into something that she wasn't. They tried to demoralize her and do all kinds of crazy shit where I had to have her home for quite a long time. But through that process, she grew to her own capacity, which was equal to being a fucking genius, because she always was a gifted child. That's why the kindergarten teacher, when she didn't like Shemaine, because Shimei wanted to slide down the slide and didn't want to get up, come in. The teacher came and slapped Shimei in the face to break Shimei's spirit, people. That's what it was. And then when I tried to take Shimei back to school after that happened, oh God, no. It didn't. Nothing worked. John couldn't get her to go to school. I couldn't get her to go to school. She ended up telling us what happened. I went to the freaking principal. I told him what happened. He sat up there and accused Shimei of lying. I said, why the fuck would she lie about something like that when she liked being at school, people? That was the thing. She liked it because she liked to learn, because Shimei was a gifted child. But they didn't want that, people, because it's too much of a fucking competition for them. If the smart ones get out of control, they gotta fucking hone them in young. That was the first time I pulled her out of school, okay? Because of that incident. Anyway, she went into grade 10. She was pulling in honors. They didn't want her in science. They didn't want her in fucking music, even though she could read music. She could play music on the piano. They didn't want her in fucking band. They refused. They literally flat out fucking refused to put her in band because they wanted to break her spirit, people. And they didn't want her in fucking science, people, because they wanted to break her fucking spirit, people. They didn't want her to be a fucking nurse. They wanted her to be, what, a tourist guide, right? To dumb her down, so that they could control her as they were plotting and scheming within their fucking ranks who was going to capitalize off of her body when they could snuff it out. Because that's what's happening. That's why nobody goes to jail. Fentanyl, people. It's too easy for the crooked cops to sit up there and say, oh, it was an accident. Yeah, she did it to herself. It was a suicide. She was depressed. It says right here, 17 years old, she was depressed. Yeah, she was depressed because what did you fucking people do? You kicked her out in the Sierra, out in the fucking streets, right? Shimei's sister, out into the fucking streets, middle of fucking winter, snow all over the place, no money, no methadone, no food, no clothes, no nothing. You just threw her out in the fucking streets, told her that if she came home, that you were going to come into the house with the fucking cops and take the Andre away. So Sierra didn't come home. Because she wanted Andre to stay home. And Sierra was being accused of something that she hadn't even fucking done, people. Okay? Within 10 days, she was injected with heroin, and that was it. It was game fucking over, and she just spiraled down for 8 years as basically the government fucking pimped her to the very bitter fucking end, and then snuffed her out and capitalized off of that, too. YouTube can't handle that fucking truth. Can't fucking handle that truth. But it goes back to this. Why people are so fucking dumb. It's like Shimei said when she was in grade 12. She was helping the teacher to mark the papers. 80% were below grade 12 level, people. Because they're stuck on their fucking cell phones talking with letters that don't even make sense. Speaking with broken language skills that don't even make fucking sense. Don't want to take the time to look up the correct spelling of a word, never mind writing a proper sentence. That's why everybody is so dumb. Because they were created to be dumb. And the ones that were smart, if they can't be controlled like Shimei, are taken out. So we'll just give it a little more and then I'm ending it. Go back to my particular.
And so this has been an extraordinary effort, and we're building it out. And as you'll recall, when we laid out our plan on October the 26th, that the 6-month interval is important. And at that point, relatively few people had their second dose 6 months before. We gave priority to those who are most vulnerable, and that program has been successful. So
oh, it's been successful, but we just locked everybody up with a bunch of fucking racist fucking immigrants, that's all. For the majority of them. Right? And for the good ones, they can't handle the fucking crimes that's going on in these old folks' homes with the old people being neglected, right? Basically, by the workforce, right? Because of bad attitude, right? Witnessed it myself, people. Okay? So did my kids, people. All right? What? They just quit. They quit because they don't want to take on the full burden of a full fucking workforce that doesn't want to fucking work, basically. Okay?
So I think...
So, before the government allows people to go in and see their loved ones and how they're really being treated, they'll just lock them out like they did with us and Uncle John. He withered away, an old broken man, broke, because he was robbed blind of his life, people, of his life, of his dignity, of his humanity, of his fucking liberty, of his family. And then they stuck a fucking knife in him, and they took his money, and they left him there, basically, to rot, with a brain of jello!
We're ahead of where we want it to be, where we expect it to.
And now they're doing it to thousands and thousands and thousands and thousands and thousands right across the fucking board because they can't afford to pay out the fucking pension plans, never mind all these superannuation life insurance policies. Because the crooks within the system have taken it all.
To be, and this is because you don't do 175,000 more boosters than planned if you're not bringing on resources and staff and locations.
Staff? No, you're recruiting you're begging for volunteers to fucking do your dirty work.
Clinics, and this isn't done by machines, this is done by people.
There, that's what I wanted you to hear. I'm gonna end it there. It's not being done by machines. That's I call bullshit. 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 Total bullshit.